Hello, everyone. Welcome back to another episode of Ask Dr. Ted for February the 2nd, 2023. I'm Dr. Ted, and I am a board-certified family practice physician and a full-time emergency physician for the last 4.5 years practicing in rural America. And once again, welcome back. So today's topic, it's a little shocking, the title, I admit it. It's called 5 Ways to Accidentally Kill Your Baby. And I know that's rough, and I hope to shock people so they go, what in the world, and turn that on, and here you are watching. So hopefully it worked. I'm not taking this lightly. There is nobody that loves our kids more than we do, parents, right? And we would give our lives for our children, no question. So I'm not taking this lightly, but I wanted people to tune in. So hopefully that's what got you to tune in. First of all, I remember a pediatrician, Richard Cantor, who's an emergency medicine pediatric physician, practices in Syracuse, New York. He's wonderful. Everybody loves listening to him. He taught us, first thing you do is you listen to the mother. If the mother says something about that kid, write it down. She is not kidding and she is not lying. Whatever she says, write it down. It happened. He says, if that mom says Martians came down from the sky and kidnapped her child and brought him back an hour later, write it down. Martians came and took her kid. And we're lucky he's back. And he's not kidding. Mothers are the best history of a child and what's going on. So listen to the moms. Next thing, number 2. If you have a newborn baby or a child, take them to a provider who knows what they're doing. A doctor, family practice, pediatrician, nurse practitioners, physician assistants, they're wonderful. If they are comfortable seeing kids and they know what they're doing, take them to them because they're going to know things that you won't know to look for on development. There's 4 things we look for on children: verbal, social, like how they interact with people; gross motor, how they run and jump and throw things; and fine motor, how their motor skills of their fingers. And there's things that they just know that you won't know to look for, and individual things that you'll have concerns about your baby that they'll be able to help you with. So you need to get somebody that, can look at your child objectively, right? Because we don't look at our kids objectively. We think they're all geniuses and they're just wonderful. And you need somebody who can look at them with less biases. Okay, so let's start from the bottom, kind of work our way up. We'll start with something. These are all things I've seen. These are not unusual. Some of them are rare, but they occur enough that I want to talk about these. And there's way more than I can go into here, but these are the 5 that I think you should know. 1, people that some women can't nurse. That's just biologically, physiologically, whatever reason, they just can't do it. Their body won't do it. That's okay. The formulas they make nowadays are wonderful. And they can come pre-mixed. If they're pre-mixed, follow the directions. And if they're powder, you definitely follow the directions. This is the first thing I want to mention. Sometimes and with inflation going up, sometimes people don't have the money. So they'll try and stretch the powder a little bit. And so they'll mix more water per scoops of the powder. And do you know what can happen to babies? If you put too much water and you don't follow the directions, just follow directions on the can of the powder, you can put too much water in and it can make the sodium in your baby's bloodstream and ultimately their brain decrease, and babies can have seizures and their brains will swell. So you have to follow the directions on those powdered baby formulas. Do not change them. Don't add more powder per water. Don't add less powder per water. Follow the directions to a T. If you have any questions, ask your doctor. Another one that I've seen this before. Kids get chicken pox. Thank heavens we don't see them very much anymore because we got a vaccine for that. But once in a while, I see them now and then. I've seen a dozen cases in the last 10 years. Kids get chicken pox. What do we all know about chicken pox? They're these little sores that blister, then they rupture and they scab and they're itchy. They really itch. So at least when I was a child, people used to take Caladril lotion or calamine lotion. Calamine lotion you put on each individual ones. Caladril is just calamine with Benadryl added. And so they put Caladril with a little Benadryl and calamine on all these little sores, and you can have hundreds of them, right? Probably more than that. And then they think, well, if it works good, the Caladril on these and they itch, well, maybe I'll give them some by mouth. And now you're giving Benadryl by mouth and Benadryl in the Caladril, and you can accidentally overdose your child on Benadryl. Benadryl, usually what will happen, it's not a fatal overdose. They get this, what's called an anticholinergic poisoning, where it affects their judgment and their brain, and they start picking at things. They literally start reaching out for things that aren't there. They can see them, but they're not there. Nobody else sees them. And that freaks the parents out, as you can imagine. It freaks the doctor out if you don't know what it is. And their judgment's bizarre. And if you get too much, you can accidentally overdose a child with Benadryl, and it can cause heart problems and stop their heart. It is a possibility. I've never seen that, but I've seen too much Benadryl, and it's a definite possibility. You can also overdose your kid on Benadryl without even knowing. Don't just give them what you think. Read the directions on the Benadryl. Benadryl's a great medicine, but it can definitely be used to excess. So chickenpox, Caladryl, do not give Benadryl by mouth. You can put calamine lotion on the individual ones, then don't give it by mouth. Or give it by mouth, but then don't put Caladryl with Benadryl also, because they absorb that Benadryl through those individual chickenpox, and now they got a double or triple dose, and that's what we were talking about. Another one, this is an interesting one, infantile spasms. This is one a lot of people don't even know exists. What it is, it's a neurologic condition in newborns. Typically between 1 and 4 months of age is the most common, but it can occur anytime between birth and 1 year. And the baby, babies make unusual behavior or unusual movements. They'll kind of startle and twitch and do different things. Those are all fine. Infantile spasms is particular though. What they do is they tend to pull their head forward and pull their legs up, almost like their arms go out, and it almost looks like they're trying to do crunches or sit-ups. You know how you pull your knees up and your head down, and it almost looks like they're doing crunches. They can also blink unusually, rhythmic blinking, and they'll come in clusters, and it typically occurs just as they're going to sleep or just as they're first awakening. If you see anything that looks like that, here's what you do. You take your cell phone, just like I'm doing here, and you videotape it and show your pediatrician or your doctor or your family doctor, whoever you see, show them a video and let them see. What those are, they're little epileptiform, or they're called hips arrhythmia. They do little EEGs. They'll send them to a specialist. They put this little markers on their brain with these little wires that it doesn't hurt, and they can take a picture of the electrical firing of your brain, and they can find if your child is having what are called infantile spasms, and I'm sure there's several categories. You can talk to a pediatric neurologist. They know all of those. And they can treat those. And if you treat them, they're completely reversible, and they do just fine. And they grow, they continue their progression neurologically, socially, fine motor, gross motor. If you don't catch it and you don't know that it's even anything unusual, their development can stop and even go down. They can regress in their neurologic development. And without treatment, they can regress and they'll just stop their development, and it can be a permanent thing. So you want to take a video, see your doctor, and then say, is this something I need to be worried about? And if they're not sure, they'll probably just send you to a pediatric neurologist, and this is very treatable if you know what it is. They're called infantile spasms. And what will happen sometimes is the kids are fine for 2 or 3 or 4 months. And then suddenly they'll start getting these weird, pull their head forward, bring their legs up like they're doing crunches or rhythmic blinking. And nobody really notices it or thinks, oh, that's kind of an odd thing. But, babies do all kinds of weird things and nobody picks it up. So that's one you need to know about. Infantile spasms. They tend to occur in clusters. You'll have them over and over and over, like I say, right as they're waking up or going to sleep. If you have any questions, take them to your doctor and let them see. Another one, infections. This is the big one, okay? If your child is seriously ill or dies, it's very likely to be because of an infection. That is one of the biggest parts of pediatrics is infections. We talked about rashes yesterday, and kids can get really serious infections. The top ones that I wrote down here, whooping cough or pertussis. That's where they cough so much, they'll get spasms of coughing, and then they gulp for air. It's not the cough, it's the gulping of air. That's the whoop, is when they gasp for air. Adults can do the same thing. You get these spasms of cough. Whooping cough is common. We see it every year. It's a bacteria, so you can't develop immunity you can if you get the infection, but it can come back again. The good news about whooping cough, pertussis, there's a vaccine for that. That's when you get the DPT, the P is pertussis. That's whooping cough. What can whooping cough cause if your baby gets it? When they cough, their blood pressure can spike, and they can have I've never seen this, but it can happen. Believe me, pediatric emergency departments can tell you stories about this. They're just terrible stories. They cough so hard that they could stop breathing, apnea. They can cough so hard that they get bleeding into their eyes and it can affect their vision. They can bleed into their brain. And you can imagine these are all horrible stories. So whooping cough is one, is an infection. But again, there's a vaccine. Epiglottitis, that's one that's caused by Haemophilus influenza typically. There's other bacteria, but that's the most common one. Do you know I have never seen epiglottitis? It used to be probably 1 or 2 a month, almost any hospital you go to, big city or smaller town, because it was just that common. It's a bacteria that grows in the community and in children, some of them. And with vaccines now, we have the H flu vaccine. We don't see, I've never seen it. In 28 years of practice, I've never seen it. Doesn't mean it doesn't happen, but that's another one. Whooping cough, epiglottitis, that's one of those really sore throats. We'll talk more about that on another one. Sore throats that can kill. I'm going to do one done on that. Meningitis, streptococcus pneumoniae, the meningitis when you're a teenager. Those are also stiff neck, headache, mental status changes. They look sick and they can get some weird rashes. Those dark purple, deep red, or even black rashes. Again, vaccinations for those. We have vaccines for all of those. The ones you cannot fix, urinary tract infections. But babies can get bladder infections. It's really common. It's not unusual. And that bladder infection, babies' borders between the outside world and the inside world is not as developed as adults. We're better at keeping the germs out and the bad stuff, or the good stuff in and the bad stuff out. Babies aren't as good. A simple bladder infection in a child or a simple infection in their lungs can get picked up in the bloodstream and they can get really, really ill. There's nothing you did wrong. It's just part of having kids. They can get those things. So one of the ways, so the infections, the way you can accidentally harm your baby or kill your baby, and again, I'm just trying to get your attention, is not noticing some key things. Their color. If their color is blue or pale, then you go in and be seen. You'll know if they look dramatically blue or dramatically pale or dramatically red, or those rashes like we talked about, you go in and be seen, okay? You don't wait. You go to an emergency room or an urgent care, you get into somebody that knows what they're looking for. Another one, besides the color, is the tone. Babies, and I've even got a picture here, babies should have good tone like this. See how their legs and arms are in flexion? Oh, hang on, I lost the picture I was looking for. There it is. See how babies, maybe that's better. Their arms are up and flexed. Their legs are flexed. That's a healthy baby. Arms are in flexion posture. Legs are in flexion posture. Look at those eyes. Clear, open. Baby's not crying. That's, babies cry, but that's a good posture. Now, on the other hand, look at this. You wouldn't even need me to tell you that. Look, that's a floppy baby. Floppy babies can be severely dehydrated or have severe bacteria growing in their bloodstream or in their brain. They can have meningitis, encephalitis. There's all kinds of things. We do not like floppy babies, right? No floppy babies. That's what we like. That's what we don't like. So you notice their color. You notice their tone. Arms should be up, legs should be up. That's a healthy baby. Their eyes are clear. They're looking around. Their respirations. If a baby is breathing faster than usual, they need to be seen. And they won't tell you, they can't talk. How do they interact with you? If they just seem to stare off and they're really listless and they're out of it, you got to be seen. And you'll generally know these things don't come on, in an instant. They kind of develop over hours, but again, it's possible. The one last thing that I was going to mention is congenital heart problems. Babies can be born with abnormal hearts, and they can look great, or they can look blue or pale or gray from anywhere from birth, and then they might look fine, and then 2 or 3 weeks later, all of a sudden they start looking blue or red or pale, and they're breathing fast, and their tone is down, and they're floppy. You go in. That's an emergency one. You don't even wait. You just go in. There's some that can go on for months before they notice them. I had one patient, dear friends and patients, when I was family practice a few years back, and their son had one of those severe congenital heart defects he was born with. It's called coarctation of the aorta, where it goes like along normal, and then it gets really narrow and then goes back, but that blood can't get through there. Well, they didn't even know that there was anything wrong till he was a teenager. He was starting to have symptoms, and somebody picked it up. He was a teenager many years later. So those are things you need to know, or you could miss something really serious on your baby. Change in color, change in tone, change in respirations, and how interactive they are. Do they interact with you, or are they floppy? Those are 5 things you can miss. You wouldn't even know it. So low sodium by mixing the formula wrong, giving Caladril and calamine, or too much Benadryl by mouth. You just kind of want to, Benadryl's not the best medication on kids. Some parents use it. Go ahead if you're comfortable with it. I just never really wrote much Benadryl for children. Infantile spasms, infections, and the top ones: whooping cough, epiglottitis, meningitis, pneumonia. I didn't mention much about pneumonia because viruses and bacteria can cause pneumonia, and urinary tract infections and all kinds of skin things. And then the last one, heart problems. And you'll know because their color and their respirations are off. Blue babies, gray babies, can't breathe babies, floppy babies, they're not good. Those you must go in for, okay? And that's what we'll do for today, and we'll talk about some other things another time. And thank you for tuning in. Okay, thanks. See you next time. Bye.